Hi, my name is Juanita, and today I'm going to be reviewing tuberculosis along with the two more commonly used antibiotics for this disease, which include isoniazid and rifampin. What is tuberculosis? Tuberculosis is a communicable infectious disease that commonly affects one's lungs, but can affect the brain, the spine, and their kidneys. It is caused by the Mycobacterium tuberculosis bacteria. In 2017, there were 9,107 cases of TB reported in the United States. Of those cases, there were 429 that were children under the age of 14. Screening for TB is typically performed by the tuberculin skin test. There are two different types of TB. You have a silent latent TB infection along with the progressive active TB disease. Latent TB infections are when an individual has been exposed to TB itself. They are asymptomatic, they are not contagious, but they do require treatment in order for them to not progress into the active TB disease. Active TB disease is where the individual is contagious. They're going to have symptoms of having a prolonged cough lasting greater than 3 weeks, weakness, fever, night sweats, having a bloody sputum, and coughing up blood. These individuals also require treatment. The two more common antibiotics given for TB include isoniazid and rifampin. Isoniazid and rifampin can be given to adults and children. In isoniazid, adults are given 5 milligrams per kilo per day. In children, they are given 10 to 15 milligrams per kilo per day, and this is over a 9-month course period. It usually costs between $62 to $365 for the 9-month course. In rifampin, adults are given 10 milligrams per kilo per day, and children are given 10 to 20 milligrams per kilo per day. This is over a 4-month course period. Rifampin will cost $310 to $395 for the 4 months. The CDC does recommend a 12-week combination regimen of these two medications for those who are at a greater likelihood for developing TB. Isoniazid is a prodrug activated by mycobacterial catalase peroxidase, targeting enzymes essential for mycolic acid synthesis. Inhibition of this will lead to bacterial cell wall disruption. Drug interactions include carbamazepine and phenytoin. This medication is a first-line drug of choice for TB. Follow-up includes having monthly sputum cultures until negative. Often this will occur 2 to 3 months after treatment. Rifampin blocks RNA transcription with interaction of the beta subunit of the mycobacterial DNA-dependent RNA polymerase. Drug interactions for this antibiotic include azoles, cyclosporin, methadone propranolol, protease inhibitors, oral contraceptives, tacrolimus, and warfarin. This antibiotic is also a first-line drug of choice for TB infections. Likewise, it also requires monthly sputum cultures until negative, and this typically is seen 2 to 3 months after treatment as well. TB is not hereditary, although a pregnant mother who is on TB treatment should finish the full course to prevent any complications to her fetus. It is rare for an infant to be born with TB. TB is spread through air particles. Myths of transmission for TB include handshaking, sharing food or beverages, or even using the same linens or toilets. The high-risk population for TB are the African American and Asian communities, correctional facilities, children, pregnant women, international travelers, and even the homeless community. Thank you for allowing me to review tuberculosis with you and the two more common antibiotics used.